I think we're live. Hello, everybody. So, wanted to join you guys today. I'm Clayton Clemens,
And I'm Matt Carson.
and we're here to talk to you about the future of Medicare supplements. Talking about some of the changes, some of the things going on that will affect you as an agency owner, and kind of what to expect going forward. Couple quick housekeeping notes. If you've got any questions throughout the webinar, definitely pop them over into that chat box. We'll see them up here. We'll try to take care of those as they come in.
Yes. Ask as you go. If you're like me, you'll think of it in the moment. And if you
Yes.
don't type it when that happens, by the end of the webinar, you'll be like, man, there was something I meant to ask and I don't remember what it was now.
For sure.
Yeah.
So definitely pop those questions in there. The more interactions, the better. And this webinar will be recorded. It'll be sent out to you all post webinar. So if you have anything come up or client walks in, feel free to step away. You'll get the recording afterwards with a few resources that are being sent out. Other than that, though, I think we're ready to start.
I believe we are.
So we will talk about the future of Medicare supplements by clicking on the slideshow.
It helps on the right screen.
There it
Now
is.
you got it.
So
Yeah.
let's talk about what's changed and why.
Yeah. So I think the precipice of what we're trying to really talk about today is that this in general is going to be such a different year than we have seen in a really long time. I've been in the Medicare space here for 11 years now. We've got people who've been here way longer or been in the industry a lot longer than me, and everyone's consensus is this is going to be some of the craziest times, for the next year or so that we have ever seen across the board. We've already done a webinar where we went pretty in depth on what we're expecting for Medicare Advantage and prescription drug plan changes. And we even alluded to a little bit in that webinar, like, hey, if you write med sups, you're not immune to this. Also, there's some crazy things happening there as well. So that's what this is today. So some of those changes, the biggest one, the rate increases. If you have checked your email or have any Medicare supplement contracts, you are seeing bigger rate increases than you are used to seeing. And if you're like us, many times you saw those rate increases and went, oh my gosh, 12%, 15%, 18%, sometimes 20%, like, oh, better grab these clients, time to start shopping. I need to get a hold of them and start trying to look for other places. But that's probably not the answer, as we're going to kind of get into here today. Like, everything's going up. It's all carriers. These double digit, sometimes deep double digit rate increases are going to be the norm.
Yeah, I've definitely been talking to a lot of agents recently about getting used to seeing double digits and not instantly flinching and being expecting those mid-teen rate increases. And we've been talking about this. We've seen rate increases starting at the beginning of the year, and we still got some more to come probably before the summer's over.
Yeah.
But once everybody starts taking 10 to 15 rate, like, now this person that moved up is right back where they were.
Same hand signals. It must be sign language for that.
Yeah, it's like it'll even out.
That's exactly right. Yeah, I think it's one of those where in the past you would expect most carriers to have, if you're lucky, a 3 to 5% rate increase. Worst case scenario, we know carriers have avoided double digits forever. So 8, 9, maybe 10%. So if you saw something bigger than that, it was time to move to another carrier. Right. I don't think that's going to be the case right now. That carrier is going to jump up their rates now. 6 months later, the carrier who you're probably looking at that's number one on the quote engine is probably going to take a rate increase that's going to put everything kind of back into perspective again. And we're hearing this from everyone. I mean, we get to attend a lot of the carriers, industry events that they do. Once a year, they bring in a lot of the big partners to kind of share state of the industry, what they're hearing. This is what Mutual of Omaha told us in March. They were like, if a carrier is not taking double digit rate increases this year, it's probably because they are losing money on it and they're just okay losing money and then eventually just blowing that block up. United Healthcare, who is like prided, I mean, it's a little bit dated now, but I remember for years, 3.2% was their national average rate increase, and they advertised that everywhere. I think almost every state this year saw a double digit rate increase. Best case for them was like 8, was probably the lowest rate increase.
I think I remember seeing a couple 9s.
Yeah, I think we got 12 or 13 in Missouri, if I remember right.
Yeah, and that's the kind of thing of like, if everyone's taking these rate increases, it's going to be fine, but it is going to be shocking to a lot of your clients who don't understand that this is the impact across the board. Our next point here is kind of a little bit of the why there. With inflation, Medicare really, or the Medicare supplements haven't really kept up with that. Think about, let's go to the store.
Yeah, because I'm a nerd and I like analogies and numbers. So I've got a little number analogy here. So I did a little research. So in 2019, I just used our local zip code here to keep things easy, but cheapest Plan G Med Sup in 2019, so 5 years ago, was $120 a month. Right now it's $143 a month. So that's an increase for sure. It's about 19% rate increase there. If you think of anything else in the world, essentially, that you buy right now, it has gone up dramatically more than that in the last 5 years. Two examples I came up with were eggs. As you're talking about going to the store, eggs are becoming a prized possession and a high-end gourmet food. Eggs have more than doubled in 5 years. It was $1.40 was the national average 5 years ago. It's $3 roughly right now. Gas was $2.38 at national average in 2019, $3.75 right now. So that's 60% increase there and over 100% increase on eggs versus less than 20% we've seen in a Med Sup. Again, I picked on Missouri, but most states are going to follow that same trend of, at most maybe a $30 increase in 5 years. Many of them, I could cherry pick some good ones that are less than $10 that the rates changed in 5 years. So it just has not kept up. What that is that the carriers have artificially kept the rates low. They've been historically trying to buy up that turning 65-year-old business because that's what they've wanted to have. So they just keep rolling out new blocks, clean new blocks. You guys have seen it every 2 or 3 years. I won't name names, but lots of carriers will rearrange the order of the names of their company or throw a new buzzword in there, and it's a new block. And they do that so that they can continue to price lower and lower. And it's artificial. That's not a actuarially sound rate. It's just a rate so that they can try to buy up more 65-year-olds. However, and I'll pass this to you here in a sec on these loss ratios, 65-year-old business is not what Medicare supplements are wanting anymore. The T65s are now actually closer to guaranteed issue loss ratios for them than they are to underwritten loss ratios, which has not been the case in the past. I know you put together a few numbers on those loss ratios, but that's really the underlying what's triggering all these increases.
And I hate to even say it because it's been so long now, but they're still feeling the effects of the COVID hit. That they expected, in 2022 for it to kind of slow down a bit, but a little unexplainably hasn't really slowed down the way that they've expected.
Yeah, I think part of it's just because everything has gotten so much more expensive. We hear all the time people who are 62, 63, 64, needing a knee replacement, needing a hip replacement. Well, I'll wait till I'm on Medicare to be able to do that because it's
insurance.
Right, because exactly, because my group plan or my ACA plan, it's going to cost me thousands of dollars. I'll wait till I'm on Medicare to do that. Well, it is helpful for the consumer, it costs them less, but that's really tanked those 65 to 67-year-old loss ratios now.
For sure. And generally speaking, a Medicare supplement carrier wants to see less than 80%. They're okay with 80%, but they want to see less for
loss
their
ratio.
Their loss ratio. Now, what they're seeing in reality, which is why we're seeing some of these rate increases happening, is they're getting into the mid 80s. Or for a big carrier, 85,
mid,
88,
upper,
somewhere in there, that'd be a big carrier. The smaller carriers that were a lot of those kind of rate chasers and trying to get into the market.
A lot of them have only been around 2-3 years.
Yeah, those ones are flirting with 90s or mid 90s.
Yeah.
So for them to get down to the 80%, let's say, you're going to have to look at a 10%, 15% rate increase.
And if you're not familiar with the loss ratio, what that means, in its simplest form, that means for every dollar of premium that's coming in, how much are you paying out in claims? So 80% loss ratio means for every dollar that it's coming in, 80 cents are getting paid out in claims, 90 is 90 cents, et cetera. So you understand agent commissions, you understand there's more administrative costs beyond just what agent commissions are. So picture if a carrier is 85, 90, 95% loss ratio, there's not money left for that carrier to make money. So they have to be raising these rates if they're going to be around for the long haul.
For sure. And that's just the kind of easy, quick math of how this is working. But what your clients just see is I'm paying more money. Why am I doing this? And that's kind of what we get into next is looking at are the Medicare supplements still worth it for the client? And I'm just going to go ahead and say, yes, they're still going to be worth it for a lot of your clients.
Yeah, barring something crazy that we don't foresee right now, at least I should say, based on these changes, there's no reason to think the Medicare supplement market is going to be unhealthy or see shrinking or anything
just
like
dry
that.
up and go away.
No,
that's not going to be a thing.
Nothing is pointing to that. I think the point we have on there is just that the typical Med Sup client might look different, let's say in the next year to 5 years than it did 10 years ago, even a year or two ago. Yeah, I think the important part that we would really want to instill is that it's really going to enforce the need for selling the experience and the benefits of a Medicare supplement more so than just the price of a Medicare supplement. If your selling points have all been around, I'm just keeping you in the cheapest Medicare supplement, and you're comparing that to, say, a MOOP or different costs that they would have on a Medicare Advantage plan, that gulf is going to get wider and wider right now as these rates go up. I also have a note on there on the Inflation Reduction Act changes. We're expecting PDP premiums to be dramatically higher this year. If you're just looking at a monthly premium basis, which again, hopefully, this is not the way that you're selling, but it can be a factor for some people. You're really going to have to distance from that, because when it's 0 on an MA to say 150 for a combined MedSup and PDP, that's not too wide. I think a lot of people could be seeing $100 or more a month in increases over the next year or two between their Medicare supplement premiums and their PDP premiums. So again, it's going to be instilling the why of a MedSup more than just the dollars and cents and logic of it.
Yeah, the best way that it's like simplest form that I've understood this was it's looking at MedSups as more of a luxury item.
Yeah.
That I can take this wherever I want to go. That I can travel, I can see any doctor that accepts Medicare.
Yep.
And I pay one bill.
Yeah, convenience. One bill every month. You don't have to check networks and doctors and referrals. You don't have to worry about co-pays. And like I said, you can go anywhere. You don't have to worry about anything. And I hope everyone here genuinely feels that, believes that. I laugh because a lot of the Medicare supplement carriers will tout how a lot of the agents who sold Medicare Advantage plans in their careers take out a Medicare supplement when they retire on themselves, which I think is usually a telling sign there of, if someone truly can't afford it, it is the easier, simpler route to go. I will also say that those Inflation Reduction Act changes are probably going to see, again, I don't want to scoop too much from our other webinar, but we'll probably see some pullback on the Medicare Advantage benefits as well. So the super flashy stuff, huge give backs, tons of dental, paying for gas and groceries and things like that. I do think that's going to pare back a lot, this year. I don't think it'll go away, but it'll be less crazy than it has been. So some of the, the flashy things that maybe detracted from the fact that like this is still a health insurance plan are probably going to be a little bit less prevalent on MAs as well, which I think will again lend itself to kind of simplifying just the look at health insurance, which again,
that's what we're doing.
That's what this is. Like that has to be the defining characteristic of why someone is choosing a Medicare Advantage or a Medicare supplement is their health insurance, and they're insuring for the next 20, 30, 40 years of their life, not their current health condition at the moment that you're talking to them there. I think that's really what it's going to come down to. Again, that should already be a part of the conversation, but I really think that's going to have to be the big narrative. Yeah. That's really going to have to be the narrative with Medicare supplements.
For sure. And Matt already mentioned it. We did do a full 1.5-hour webinar on the changes
real long
with everything going on in the MA market and the PDP side with those Inflation Reduction Acts. So definitely check those out. Give us a call here. We can kind of go through those updates, but just know that those updates are also impacting your Medicare supplement.
Totally. It's all pretty intertwined. A couple other notes on the, is it still worth it? We've got the note on there, retention for the agency. The retention is still fantastic on a Medicare supplement. I will maybe add the caveat of a properly sold Medicare supplement, again, of selling the need for the plan, selling the carrier, selling the experience, not just rates and the cheapest thing there. If someone's truly bought into that there, the retention is fantastic on Medicare supplements. It is a much less labor intensive product for you to service than a Medicare Advantage plan typically, and you run a lot less risk. I don't want to say no risk, but less risk year to year of having your block of business implode because a carrier has just completely changed everything about it. So still very worth it from that. The one thing I will say is if you had clients who are price conscious and who maybe were already tight on affording a Medicare supplement premium, again, expect to see those continued increase. And I don't even know that this is, I don't think this is probably a 1 year only thing, these double digits. I think we may see, a few years of this to kind of correct the market price before things do levelize again. So expect the prices to go up there, expect the prices to go up on PDP. you know who some of your clients are who might be tight already there.
Yeah.
I would just make sure that you're having the conversations with those. Again, it's not a mass exodus to MA, but it's having that conversation about why they're on that plan and making sure they're truly bought into why they're spending as much as they are each month. And if they're no longer comfortable with that, looking at other options for them.
For sure. And that's a great segue into the next part of looking at how can my agency adjust to these changes? And I think you were painting that perfect picture of look at that big picture and see your clients that might be already flirting with this is a little bit too expensive for me.
Yep.
How can I make this more affordable? And the answer could be switching to a Medicare Advantage plan. It could be.
Absolutely.
But you have to understand where they're at with it financially and if it's going to work for them, for their doctors, where they need to go for care, all of those different things.
Absolutely. It's just nuanced. I think that's the thing. Like changes always spell opportunity. I would say that this is the most change that we have seen in a very long time. A lot of people are saying since 2006 with the introduction of Medicare Advantage and PDP, as far as a crazy year in the market, that spells tons of opportunity. So just making sure that you are the calm voice, that you are, delivering those touch points to your clients, that you're explaining to them, to expect these changes. And again, why they're choosing, whether it's Medicare supplement or Medicare Advantage, that you're really getting to the core of why they are on that product, and that it cannot be about one flashy benefit, and that it cannot be about just the monthly premium. It's got to be that whole picture.
Yeah, and changing how you sell the Medicare supplements, I think you nailed it. And then you add in the fact that their PDP is going to cost more. So like you have to take a look at not just how much their Medicare supplements costing, but their health care as a whole, because they're going to need that PDP. And unfortunately, people might look at opting out of having a Part D plan.
Yeah.
But that's a scary reality that we have to kind of tell them, like, well, then what happens if you get a drug come June next year?
Yeah.
Of like, needing to look at those things. So just telling them the whole picture, changing how you're selling that a little bit. And then the adjustment of if they do switch to a Medicare Advantage plan, cross-selling becomes even more vital to make up some profit there. Because they're going to have such a big budget that they're already working with, say like that $150, how can we allocate some of that for additional things that could help their Medicare Advantage plan be a little bit more
robust?
Yeah. Having that kind of package of benefits built in here. Like, let's look at a hospital indemnity plan.
Absolutely.
And you talked about, I don't want to get too much into the MA changes, but some of those other flashy benefits, like let's just throw dental out there. They have standalone dental plans. So if one cuts that back, hey, here's a consistent dental plan I can get you on. So if we need to look at different MA plans in the future, we know we're set with dental. We need to take that out of the equation.
Totally. And I would say that goes the other direction as well, of if a client is choosing to stay on a Medicare supplement, or, say you're meeting with a 65-year-old making the choice between the supplement or MA, building that total package, I think, is such a big point. And especially if you can help get beyond selling based on a monthly premium and instead selling on that total package.
Right.
By the time someone's going from zero to say $200, $250 a month for a med supp and a PDP, if they're buying into that package of benefits and that experience, not just a monthly premium, adding some cancer insurance, adding some prescription, or not prescription drugs, some dental coverage as well to that, another $50 a month can buy them a ton of extra protection. I would really, really recommend that's a part of your presentation for that. I think that's going to be crucial to everything there, especially, again, we keep dipping into the MA and PDP, but you might not be getting paid as much on your PDPs. You might not be getting paid on some whole carriers PDPs this year. So you might be looking for places to make up some income there too.
And with all the different changes, people like plans might leave different areas. There could be those service area reductions. So your folks that wish they could have gone back to a med supp but couldn't underwrite, if they have somebody
really
leave, they might be able to jump back into a Medicare supplement.
That's a super good point. That there is some expectation of service area reductions this AEP on MA. So
So there could be some flowing back the other way as some people are switching over. So.
Yeah, very good point. I think probably the last point I would make on this, as far as how to adjust, is just to be careful about not stereotyping or painting your clients into one camp or the other before you have had the chance to really explain both. Again, this is just good practice, but especially with some of these changes, you're going to have to thoroughly explain both options without bias and without making it all about the dollars and cents every month. And again, that holistic look at everything there, because if you just categorize based on you're young and healthy, you need an MA, you're older and have problems, you need a med sub, excuse me, or based on income or other factors, yeah, that can't be the only thing you're looking at.
For sure. So I got this question here. It says, New York and several other states have vastly increased some to many PDP premiums to get ahead of the 6% limit starting in 2024. Do you anticipate plans finding a way around the 6% cap, taking full percentage increases, or how are they going to, plans up to 50%?
So that 6% number is, there's so much misinformation spread about that, and I think that's probably what you're alluding to there. The 6% cap on PDP premium increases is not on specific plans. Plans can increase their premiums by whatever they want going forward. The 6% is only the NASH base average, the beneficiary premium average, that's used to determine the like LIS threshold, the late enrollment penalty. That's all that 6% is capped. It's capping that amount that's the national benchmark cannot increase by more than 6% each year. Individual carriers and individual plans can increase their premiums by whatever they want going forward at any point. But there is a massive amount of wrong information being spread about that. So I don't blame you at all for having heard it that way. But anyway, no, I don't think any carriers are going to be like proactively trying to do that. I think that we are going to see huge increases, right, but it's not proactive out of fear of the 6% cap, again, since they don't have that. It's just going to be because that's the only way that they can possibly keep the plans profitable, because so much cost burden is being shifted to them. Sure. Madeline, if you want some more information on that, definitely watch the webinar. It was myself and Olivia did a month ago, roughly. We went through the Inflation Reduction Act and what it means for PDP plans, but I think that would probably give you a lot of those, or just reach out.
For sure. And have you heard what PDP deductibles will be like?
I don't, man, I know I've seen 595, and I can't remember if that was speculative, if that's last year's number, if that's Resolute, but I know I've seen that number written somewhere. Patty, we will make sure that we get that to you if we've got that. I don't want to give a wrong answer on here.
You know, and it might be a good idea too, for in our follow-up, that we go ahead and put that other webinar recording on there. I know we've referred to it a lot here. It is an hour and a half, so feel free to call us.
The last like 40 minutes are questions. In fairness, we had over 100 questions on that webinar.
So feel free to reach out to us. We can help summarize that. We got a ton of blogs and resources on all of those changes.
Deductible, I'm reading here on CMS. It's I said 595. It's 590 is the 2025 Part D deductible. And basically everything's pointing to the vast majority of plans will have a deductible, and in many cases those tier 1 and tier 2 drugs, the generics and whatnot that have been exempt from the deductible in past years probably will be on deductible for a lot of plans this year. Cool.
So, I've clicked away. It won't let me do it again.
What'd you do?
There we go. So some key takeaways that we've kind of harped on a few times here, but these rate changes, like Carson said, is not going to be like a one and done situation. It could be a few years, so we're seeing them calm back down.
Market correction here for a little while, and that it's going to levelize. Like, just get proactive with your clients, sell why they are on a Medicare supplement, not to jump ship and panic over $20, $30, $40 a month premium increases, but knowing also not to panic yourself and try to see a big rate increase and immediately try to move all those clients to another company, because that other company is probably going to see some of these too.
And explaining in those switches, where like if you've had a client that's traditionally switched every time they got a big rate increase, letting them know, like, if we do this, we could be doing the same thing again next year and year after year after. Let's look at somebody a little bit more stable that's been in the market a long time that might help levelize, so we're not having to do this.
And look at those loss ratios.
Right.
CSG publishes those. I'm guessing most of you guys are using the CSG quote engine. If you don't, you've got access to it with us for free. But if you go to the market analytics checkbox on the left-hand side there, you can then see it. They're updated once a year, so the numbers right now are as of end of 2023. But look at some of those numbers. I will add the note there of, like, look at sample size. Sometimes it's a newer block of business. It'll tell you how many lives it's measuring. If it's only a few thousand lives, don't put too much stock into it. But if it's 50, 100,000, or in some cases millions of lives that they have there, and that loss ratio is 85, 90%, like, rate increases are going to happen. They cannot keep selling at that price without raising the rates on that block of business. So, and vice versa, if you're seeing carriers, there was a few when we were looking that were upper 60s, lower 70s that are pretty big names there.
Yeah,
Like,
ooh,
granted,
right.
most of those were already $50, $60, $70 higher than the lowest rate, but like there's a reason that they're profitable right now. So those carriers probably will not need to take as great of it or as high of increases.
For sure. Next takeaway is all these crazy changes that we're talking about here. Like I said, I think we're going to put that in that follow-up email for you guys because a lot of this kind of goes hand in hand. But got a good question here on how is the non-discrimination section 1557 ruling going to affect the med subs?
Yeah, so that is very much like the carriers are still reading through everything. It's something where we're very plugged in with integrity and their compliance and legal teams as well on that. Right now, it's still kind of in the air. But yes, I mean, the wording in there has some pretty strong things that would essentially make it sound as though all Medicare supplements would have to be community rated, couldn't be discriminated on for age, gender, sex, anything like that. And that, yeah, there would have to be an under 65 option everywhere. Depending on how the wording's interpreted, potentially health conditions or something that couldn't be discriminated. So anyway, yes, there's a lot of things in there that could cause a lot of changes, but at the moment, nothing is etched in stone as to how that's going to be implemented and how carriers will be forced to respond yet. But we are very, very closely watching that. Good question.
Sure. I feel like that's a big TBD. Like that will be very to be determined.
It absolutely will be. Yep.
Next is, we talked about this a bunch, was talking about the MedSup experience over just the price of it, because that gap's going to get bigger where a $0 premium MA plan is going to look better. But we got to talk about why we're on this MedSup, why this works best for you and your situation.
Yep, absolutely. Just again, making it about the experience and what it's like to have a Medicare supplement versus what it is like to be an owner of a Medicare Advantage plan. There is a difference in what it feels like to be a consumer of each of those products, and to make sure that each person is choosing their path as much based on what it feels like to be a consumer of that plan as they are on the monthly premium.
For sure. And this last key takeaway is looking at cross-selling. Cross-selling being more important than ever, especially for those clients that want to get closer to a Medicare Advantage while still staying on the SUP. But then you're going to have your people that are leaving the supplement, going to MA. Use some of that budget that they already had in place to help make a more robust plan over here.
Yeah, I mean, it's a win-win for you and the customer in that situation. If they are comfortable paying that higher premium right now, I'm not saying replace every dollar of the premium.
Right.
Don't sell things they don't need. But I hope, and if you don't believe this, talk to us more because we'll get you to believe this, that all of you believe that every one of your clients needs, at bare minimum, a cancer insurance plan. If they're on a Medicare Advantage plan, they need to be presented a hospital indemnity plan, and depending on what their benefits look like, potentially dental insurance as well. Those are all needs that a client has. If they're comfortable already paying $150, $200 a month, you don't have to go to zero. Use half that to build a better package of coverage than what they have with just a Medicare Advantage plan alone.
Here's a good question. With rates going up, do you see high deductible G becoming a larger market share in years to come?
Potentially. The thing to keep in mind with that is like it's still influenced by a lot of the same factors that the others are. It just has a little bit bigger, has a bigger gatekeeper with the high deductible there. But outside of that, like it's the same actuarial data that impacts that. I mean, once they hit that amount, it's a plan G or really a plan F, because usually you've already hit the Part B deductible there. So like it still has burden, and by and large, it's not the everyday users of the plans that are the ones that hurt the actuarial numbers. It's the worst case scenario ones. It's the people that are on chemo, dialysis, big hospital stays, joint replacements, things like that. Those are still going to impact high deductible plans close to as highly. The only thing that could be beneficial there is that there could be a little bit of like selective bias there of the type of people who are willing to take a high deductible plan potentially could be healthier. So anyway, right out the gate, I wouldn't expect to see those plans really, take off all of a sudden. But I could see in the long run, if G and F and N rates keep going higher, and it's only healthier blocks that are on those high deductible plans, it could become a more viable option there. And that's another great opportunity for a hospital indemnity cross-sell there to be able to offset some of that deductible too.
For sure. And we've talked a lot about Plan N being another option for these rate increases, as that's kind of been the healthier, stable block. That block will have typically a little bit better of a loss ratio
True,
than the
yeah.
Plan G block. So
Yeah,
Probably
I
too.
say that because like a lot of what we've based on the past is that it can't get guaranteed issue business on Plan N. However, now we know that the T65 block is almost as bad as guaranteed issue, and that's going to impact Plan N, or has the potential to impact Plan N just as much as G.
for sure.
I had a question about how to get the recording. They're not automatically sent out. Those are all uploaded to our YouTube page. So it's just Senior Marketing Specialists on YouTube. That's where you can find the recording for this.
We will put the recordings in the follow-up emails that get sent
perfect.
out.
They said
So,
they didn't get it on the last one. So
okay, we'll make sure
if
it
you can't
happens.
find a past one, YouTube page is where all those are. Senior
Definitely.
Marketing Specialists on YouTube.
Like and subscribe.
Hit the bell notification.
So we'll turn into streamers real quick. Will 12-month price guarantees that are given some carriers on MedSup going to be honored, or will any price change or go into effect? So I think I get what you're going with.
Yeah.
Carriers are still offering that 12-month.
Yep.
If they are offering it before, they're still offering that.
Yeah, I haven't seen any carriers
Drop
stop
that
offering
option.
that.
Yeah.
Yeah, but keep in mind that those are typically only for the first 12 months that someone is on that plan, that they will have that, of course. So those rate increases can happen anytime throughout the year. To the second half there of, will all price changes go into effect January 1st? No. Most carriers are on an annual cycle, but it's not January 1st for a lot of them. It's whenever they are. Like UHCs are usually in kind of the April or June, July time span. Mutual of Omaha's are usually later in the summer. It just kind of varies carrier to carrier. One thing, excuse me, that is nice though sometimes is if you're in a attained age state, a lot of times when a client is getting that attained age rate increase, the carrier will hold and only do one rate increase every 12 months. So they won't say they aged up in May and then there was a block increase in September. They'll hit that rate up age increase in May, and then they'll hold it until the following May, but they will get both that attained age increase and the block increase both at the same time. It's not every carrier, but a lot of carriers try to do that just so that your clients don't get multiple increases in the same year.
That's another good place, that CSG quoting tool. If you click the market analytics on the left side of the screen, you can pull those up and they'll tell you when they took those rate increases.
Yep. And a lot of them you can see it's literally a dead cycle every 12 months. Yeah. Not all, but most of the big carriers, it's pretty clockwork.
For sure. Well, I don't see that we have any other questions, so I'm going to click over here again because I messed that up one more time.
Yeah.
But thank you all for coming. Definitely love the interaction. This is great. This is why we do these webinars.
Yeah.
Be looking out for that follow-up email. Check out the YouTube page. There's just so many changes and so much news coming out that you really got to be plugged into like 3 or 4 different aspects. So check out the YouTube page. On our smsteam.net webpage that we have here posted, that's our personal page where we have a news section that if we're getting more information, there's usually going to be a blog on it. It's going to be posted to our Facebook, probably a video on YouTube. So how do you consume content? Go follow it that way.
We got lots of ways to do it. for sure.
And any questions, as always, give us a call at 800-689-2800. Ask for anybody on the team. We'll help try to figure out what kind of places you need to go, what information you need, and get you all the right content that you're needing.
Absolutely. And this all means opportunity. Like I said, that's the last thing I would end on, is just all these changes mean opportunity for you guys as advisors. Your clients will have questions. Your clients are seeing changes. If you service your clients right, they will be reaching out to you for all of this. If you are helping them with those things, they will be referring people to you for that. So while the changes are scary and create work, they also create tons of opportunity.
Exactly. Well, Carson, thanks for coming down for a webinar.
Absolutely.
I love seeing you on here.
Yep.
So we'll see you guys later. Give us a call if you have any questions.
Thanks, everybody.
Thanks, guys.